The Health and Allied Workers Indaba trade union is one of 19 applicants taking both Eskom and the government to court over rolling blackouts. They want government's response to the energy crisis to be deemed unconstitutional and want hospitals, among other public services, to be exempt from the power cuts. Let's find out more from Haitu's General Secretary Lerato Mthunzi. Thank you very much, Ms. Mthunzi, for your time this evening. So we did speak to NUMSA about this court case a little bit earlier to get a sense of the outcomes, the relief that this group of applicants is seeking. Can you tell us a little bit more about what happened on day one and specifically the testimony with regards to the impact of load shedding on healthcare?
Good evening and good evening to all your viewers. Our day one court today was aimed at nothing but to pray to the court to deem load shedding as unconstitutional. And we are basing this on the fact that supreme in our constitution is the right to life. And we've seen since the implementation of load shedding that most of the patients in our health facilities have been subjected to death that are not even reported. We've released several statements to the government to say we need to treat load shedding the same way as we have been treating COVID-19. Unfortunately, what we've seen is that there is no openness and there is no clarity. We've seen our patients dying, especially those who are oxygen dependent and the children that are depending on being on incubators and those who are diagnosed with childhood jaundice. So yes, we are saying the court must deem load shedding as completely unconstitutional and healthcare facilities must be exempted.
So I want to try and understand the situation around patients who allegedly have lost their life as a result of load shedding. We understand from what we heard from NUMSA spokesperson Pagamila Hlubi Majola, that the death certificate of patients whose deaths can be attributed to load shedding wouldn't say load shedding. It would say perhaps suffocation or heart failure or something like that. Surely there should be investigations into the root causes of these deaths. And have you seen any action on the part of clinics or hospitals to determine the true cause, if load shedding is then that cause?
Most definitely, because if patients cannot be resuscitated, their cause of death would either be said to even be natural. We've not, let alone seeing their cause of death being declared as what it is, which is load shedding. We have not seen the government being open enough, like I said earlier, to say how many people are losing their lives on a daily because of this load shedding that is sometimes even not planned. We have a serious injustice that the government has proved that they cannot even have backup. They have no generator backups in most of our facilities, no UPS systems. So to be very honest with you, there is no accountability that is taken by the government. We've seen the president of the country coming forward and saying, I cannot be held legally liable for supplying electricity, which is very, absurd, thinking that when they went into elections and they went into be put into power, they promised that they'll be able to sustain not just the electricity, but ensure that they save lives of the innocent and the poor of the poorest of South Africans.
Of course, Haitu represents workers in the health space. Can you tell us about the impact on workers having to deal with load shedding?
You know, the biggest thing is going to work and knowing that when load shedding hits, depending on what stage we are in, you are not going to be able to do what you have pledged, what you have oathed to do as a healthcare provider. It's very daunting. It's almost as if you are going to work to be really an accomplice of murder, which is something that we are not looking at because we are not looking at the psyche of the healthcare workers. We are not debriefing them. We are not looking after them in any shape or form. We are expecting them to move from one death to another, and it must be business as usual.
Can you tell us, as Haitu and as one of a group of applicants for this court order, what are you hoping for in terms of the outcome? We know you are hoping that the court will find that load shedding or power cuts are unconstitutional, but in a practical sense, what do you hope to see? Because government will say, well, we've come on board, we have exempted as many health facilities from power cuts as we can, given the complexity of how they tie into the grid. So how do we overcome that problem?
Look, we are not asking for much. We are saying all healthcare facilities, clinics, primary healthcare, community healthcare center, anything that is linked to being a health facility must be totally exempted from load shedding. And we are asking this because these are institutions of life-saving. These are not institutions where we are selling bread or tin stuff. We are literally saying the government has got a responsibility to show and demonstrate that lives of South African citizens do really matter. We're not even expecting the government to oppose, especially when it came to our submission, which are very clear to say the right to life is a right that all South Africans should be enjoying in our country. So yes, our sought out relief that we are seeking is for every healthcare facility to be exempted from load shedding without even wanting to go in debating further.
Well, thank you very much for speaking to us. That was Lerato Mthunzi, General Secretary of the Health and Allied Workers Indaba Trade Union, giving us an update on that court case which got underway today.